In today's news, everyone is talking about President Obama's new health care reform. But what exactly is this reform supposed to do? President Obama's budget proposal includes nearly $1 trillion, in new health care spending, a $634 billion reserve fund as a down payment for expanded coverage, and nearly $350 billion in offset increases to physician reimbursements and other government programs. The fund would be paid for in part through $318 billion in tax increases on filers who itemize competitive bidding for Medicare Advantage plans and tighter government price controls on drug makers. The Republican conference has prepared a list of fast facts about the proposal. There are 10 fast facts. Number 1, more spending will not control costs. Number 2, government spending means government control. Number 3, competitive bidding, a sham. Number 4, undermines the cancer agenda. This budget proposes $6 billion in new cancer funding for the National Institutes of Health, but it limits the individual's ability to deduct donations to charities like that of the American Cancer Society and and imposes new drug price controls that will discourage companies from developing new cancer therapies. Number 5, weakens Medicare's solvency. Because the budget includes nearly $330 billion in increases to physician reimbursements without proposing offsets for this new spending, Congress has done this in the past, and Medicare spending will actually rise under the President's proposals, which Medicare's nearly $86 trillion in unfunded obligations already. Number 6, prolongs downturn in the housing market. In order to pay for the health care reserve fund, the budget proposes that to reduce certain individuals' ability to deduct mortgage interest, even though the Congressional Budget Office predicts that housing starts in 2011 will be still at or below levels last seen in the early 1990s. Number 7, undermines parental control. A proposed expansion of family planning programs through Medicaid would permit children of any income level to qualify for family planning services without parental approval. Number 8, raids Medicare and Medicaid funds. The budget includes proposed of $24 billion in savings from the Medicare and Medicaid improvement funds. According to the current law, the Medicare Improvement Fund is designated specifically to make improvements under the original Medicare fee-for-service program. Number 9, harms medical innovation, and number 10 is a budgetary gimmick. The budget presumes that spending on states' children's health insurance programs will drop by 66% in the fiscal year 2014, a reduction many members may consider unrealistic, and therefore they intend to mask the true size of the administration's spending proposals. President Obama signed this U.S. health reform bill into law at the White House during a ceremony. According to the WhiteHouse.gov, the health reform will make health care more affordable for Americans. It will make health insurers more accountable, expand health coverage to all Americans, and make the health system sustainable, stabilizing family budgets, the federal budget, and the economy. It is supposed to make the insurance more affordable by providing the largest middle-class tax cut for health care in history. Under the plan, 95% of Americans will be insured. It is supposed to set up a new competitive health insurance market, giving millions of Americans the same choices of insurance that members of Congress will have. It is also supposed to end discrimination against Americans with pre-existing conditions. coverage is projected to commence sometime in 2014. There are currently 32 million people without health insurance, which is roughly 83% of American citizens. According to Obama's website, as accessed in March 2009, some of the things his plan includes are requiring insurance companies to cover pre-existing conditions, creating a small business health tax credit to help them provide insurance, and requiring large employers that don't offer coverage to contribute a percentage of payroll toward their employees' health care costs. It also establishes a national health insurance exchange with a range of private insurance options as well as a new public plan based on benefits available to members of Congress. As you can see, this is what President Obama's new health care reform is consisted of, and